The structure passing through petrotympanic fissure except first is cauda tympani nerve, second is anterior tympanic artery, third one is anterior ligament of malleus, and fourth one is lesser petrogenial nerve. Answer of this question is lesser petrogenial nerve. Rest three are passing through petrotympanic fissure. Lesser petrogenial nerve goes through canaliculus innominatus into the middle cranial fossa between the foramen ovale and foramen spinosum and goes into the hiatus of lesser petrogenial nerve. So answer of this question is lesser petrogenial nerve. The petrotympanic fissure, also known as Gleiserian fissure after name of Johann Heinrich Gleiser, French scientist, and is a small fissure in the temporal bone that connects the mandibular fossa to the tympanic cavity. It is a median continuation of tympanosquamous suture that runs between the superior border of the tympanic and petrous part of the temporal bone, and this is also called tympanosquamous suture. It is actually median extension of tympanosquamous suture as a petrotympanic fissure. This fissure contains cauda tympani, anterior ligament of malleus, and anterior tympanic artery, a branch of internal maxillary artery. The fissure composed of two canals, external canal larger, lateral containing anterior ligament of malleus and anterior tympanic cavity. Internal canal is smaller, medial containing cauda tympani, also known as canal of Hoogier, anterior canaliculus of cauda tympani, and anterior tympanic aperture. This contain the canal of Hoogier's. So anterior tympanic artery and this anterior ligament of malleus is situated in the larger or external part of this petrotympanic fissure, while the cauda tympani situated in a smaller or internal part of this fissure. Boundaries of this petrotympanic fissure. Dividing this petrotympanic fissure into two parts, lateral and medial. Laterally, it is anteriorly bounded by squamous part of temporal bone and posteriorly by tympanic part. That part is known as squamotympanic fissure. Medially, this petrotympanic fissure divided by vertical plate coming from the tegment tympani, and this petrotympanic fissure divided into anterior and posterior. Anterior part divided by this vertical plate coming from tegment tympani is known as petrotympanic fissure, because this tegment tympani is part of petrous bone, and posterior part of this petrotympanic fissure medial portion is known as the petrotympanic fissure. The anterior malleolar ligament is one of the suspensory middle ligaments located between the anterior process of malleus and the bony wall of the middle ear cavity. One arm of this AML reaches the capsule of temporomandibular joint, and the other part of this reaches to the sphenoid bone. This ligament is a smooth arrangement of fiber within the connective tissue which connect the mandibular fossa to the middle ear. The AML provides mechanical support to the malleus head. The structural changes of this AML caused by the middle ear disease such as otitis media with effusion may affect the transfer function of middle ear from sound transmission, and fixation of this AML could result in decrease of ossicular velocity about 3 to 8 dB at low frequency. This AML also may damage during this temporomandibular joint surgery, which may damage the tympanic membrane and middle ear during this manipulation of temporomandibular joint. The anterior tympanic artery, also known as Gleiserian artery, is a branch of the maxillary artery. It passes through the petrotympanic fissure to enter the middle ear, where it contributes to the formation of circular anastomosis around the tympanic membrane, and it provides the arterial supply of the lining of the middle ear. And this cauda tympani arises from 5 mm above the sternum foramen from the facial nerve and goes in the posterior canaliculus, then into the middle ear, then anterior canaliculus, passes through petrotympanic fissure, ultimately join the lingual nerve in the infratemporal fossa. Another name of anterior malleolar ligament is the Caserio ligament.